Welcome back, everyone, to another deep dive. Today, we're really diving into the fascinating world of computer vision, but specifically its potential in neurology.
Really exciting area.
Yeah, and just quickly before we get started, as always, this is for education only. We have no commercial goals here.
Yeah.
And of course, what we discuss is just a brief summary. You'll want to read the full paper for the complete picture.
Absolutely.
What we really want to focus on today is what neurologists like ourselves can practically use in our daily practice. So let's dig into the data and practical points.
Sounds good. Neurology has always relied on visual analysis,
Right.
observing things like tremor, ataxia, and nystagmus.
Yeah.
And we've tried to standardize this with score-based assessments, but they don't always capture those fine details of movement. That's where computer vision comes in. It offers objective measures from video footage.
And this idea of observation in neurology, it's not new, right? We've been doing it for centuries.
Absolutely. Think back to Charcot in the 19th century with his detailed drawings.
Oh, yeah, that's right. Yeah.
And then came cinematography, a huge leap forward in the late 19th century. It allowed us to analyze neurological phenomena over time.
Yeah, and even today, video is key for clinical evaluations, both in real time and offline. We're using these semi-quantitative scales, the UPDRS, the SARA.
Right. But even with all this history and current reliance on video, neurological phenotyping still has its limitations.
Yeah, way.
Well, we depend on clinical judgment in these kind of broad categories, so it's sometimes difficult to capture the full spatial and temporal complexity of these abnormal movements, especially when you have different movement disorders interacting in a single patient.
That makes sense, yeah. So are there any specific examples where this limitation becomes really apparent?
Well, take nystagmus, for example. Quantifying it could give us so much information about underlying brain disorders, but we lack those easy bedside methods to actually do it.
Cool.
Same with epileptic seizures. We often record them, but rarely quantify those crucial diagnostic details.
Yeah, that's true.
And then there's dystonia. The scales we have don't always capture those dynamic features, which are crucial for judging how well a treatment's working.
And what about Parkinson's disease?
Yeah, even in Parkinson's disease, score-based evaluations can be inconsistent. Different clinicians might focus on different aspects of movement, like amplitude, rhythmicity, or velocity, so the scores can vary.
So it sounds like these rating scales, while useful, have some inherent limitations.
They do. Low inter-rater reliability, limited sensitivity to change, especially in early disease stages. And because they're categorical, they limit the type of statistical analyses we can use.
So there's a real need for more comprehensive, scalable, and objective methods.
Exactly.
Now we have those advanced techniques like marker-based motion capture and body-worn sensors. But
they're resource-intensive, invasive, and not accessible for widespread use. And that's where computer vision enters the scene.
okay, so what's the fundamental capability that computer vision brings to the table?
At its core, computer vision is about machines analyzing image and video data. Imagine machines understanding what they see, identifying objects like a hand or a face, locating them, and outlining their boundaries within an image.
I see.
So early approaches to computer vision, they relied on hand-engineered features.
So basically predefined patterns that could recognize specific elements.
Yeah, things like edges, textures. But this had its limitations because real-world scenarios are so variable.
Yeah, I can imagine.
And that's where deep learning methods came in, specifically convolutional neural networks, or CNNs. These models are amazing because they learn features directly from the data. No more hand engineering.
So they adapt and learn on their own.
Exactly. And CNNs have revolutionized biomedical image analysis. More recently, transformer models, initially used in natural language processing, are now making waves in computer vision.
So there's constant evolution happening in the field.
Absolutely.
Now, the paper specifically highlights pose estimation as being particularly relevant to neurology.
Yeah.
What exactly
Right.
is pose estimation?
Imagine creating a model of the human body with all its key joints. Pose estimation, often using CNNs, tracks these joints in a video, allowing us to follow body configuration and movement without any physical markers.
Markerless motion capture.
Exactly. This has become a powerful tool in neuroscience research. Neurogenetics, neuromodulation, brain mapping, and even closed-loop systems where the estimated pose controls feedback. And what's really remarkable is that while early models required tons of data and computing power, now we have models that work in real time, even on smartphones.
Wow. So we're talking truly portable, accessible technology.
Exactly. Figure 1 in the paper actually shows a typical workflow. You record a video, the algorithm estimates the pose, tracking all the key points, and from that data, you can calculate various movement features.
So how's this being applied to neurology specifically for quantitative phenotyping?
Well, researchers are now using these pose estimation algorithms to measure movements objectively, both in patients and controls. And the results are promising. They're finding high accuracy and precision, often matching gold standard measures like accelerometers or those sophisticated motion capture systems.
That's impressive.
What's truly game-changing is that computer vision lets us do this markerless motion capture with just a standard 2D video. From something as simple as a smartphone or a portable camera, this makes it incredibly accessible and scalable for both clinical use and remote monitoring.
So we're talking potentially using everyday technology to get really precise movement data.
Exactly.
And the paper gives a whole bunch of examples of how this is being applied. Can you walk us through some of those?
Yep, sure. So they've used it to analyze various types of tremors. Essential tremor, dystonic tremor, Parkinsonian tremor, you name it. And then there's bradykinesia, facial movement disorders like blepharospasm, facial palsy, sacchetix, myasthenia gravis, even eye movements. Nystagmus, gaze position, vestibulo-ocular reflex, smooth pursuit. They're even using it to study naturalistic scanning, like how our eyes move when we're thinking.
Wow.
And it doesn't stop there. They're looking at gait and postural disorders, handwriting and neurodegenerative diseases, head deviations and cervical dystonia, seizure semiology, sleep-related postures. Figure 2 in the paper actually has some great illustrations of this.
That is a really broad range of applications.
Mhm.
And the paper also stresses how robust these algorithms are across different settings and populations.
Yeah, it's pretty amazing. They've shown that these algorithms work in all sorts of places, from operating rooms and concert halls to epilepsy monitoring units, sleep labs, homes, outpatient clinics. They've even used it with children. And what's even more interesting is that they can apply these algorithms to old video recordings.
So we're not just limited to new data.
Exactly.
Okay, so let's bring this back to the practicing neurologist.
Right.
What potential does this have for improving our daily clinical practice, and how can we practically implement this technology?
Well, first and foremost, computer vision offers objective, quantitative assessments, something that we've been lacking with those traditional rating scales.
So we can move beyond subjective scores to concrete data.
Exactly. For instance, imagine being able to quantify tremor amplitude and frequency in real time at the bedside, maybe even with a smartphone app.
So much more precise than just eyeballing it.
Right. And think about the implications for monitoring disease progression and treatment response. We could personalize DBS settings or botulinum toxin injections much more effectively.
So instead of relying on a patient's report or our own observations, we'd have precise data on how the tremor is actually responding to treatment.
Exactly. And it's not just tremors. This technology could also help us diagnose and quantify complex conditions like nystagmus, seizure semiology, myasthenia gravis, sleep-associated symptoms, mood disorders, even those tricky combined movement disorders.
It really opens up a lot of possibilities.
And with the rise of telemedicine, think about the potential for remote diagnostics, disease tracking, self-administered assessments, more frequent monitoring. We could reach patients in remote areas.
So it could really transform how we deliver neurological care.
Absolutely.
Now, what about clinical trials? How could computer vision contribute to research?
Oh, it has huge potential there. Think about it. With computer vision, we could get much more sensitive and granular outcome measures in trials. That's crucial for evaluating new drugs or neurotechnologies.
So we could detect smaller but meaningful changes.
Exactly. And that means we might need fewer participants or shorter trial durations, which could potentially reduce costs and speed up the development of new therapies. And the high-resolution digital biomarkers we get from computer vision can make trials more sensitive and efficient.
So it could really accelerate the pace of discovery.
Absolutely. And imagine patients recording their motor symptoms at home with video. We'd get continuous data, not just snapshots from clinic visits. This would be invaluable, especially for early or pre-symptomatic stages of disease.
So much richer data than we currently have.
Right. And it could even improve access to trials for people in rural areas. We could use video calls for telehealth and telemonitoring.
So breaking down those geographical barriers to research participation.
Exactly.
Now, beyond refining our current approaches, could computer vision lead to entirely new discoveries?
I think that's where it gets really exciting. By combining pose tracking with machine learning, we can uncover subtle movement patterns, things the human eye might miss. This could lead to earlier detection of diseases like Alzheimer's, for example, through tiny changes in hand movements. Or we might improve the diagnosis of musicians' dystonia by analyzing their performance.
So we're talking about identifying new biomarkers that we weren't even aware before.
Exactly, and these algorithms can be designed to discover new patterns without relying on our predefined clinical features.
So it's not just about measuring what we already know, it's about discovering what we don't know.
Precisely. And in the future, imagine integrating this with virtual reality. We could assess sensorimotor processes in completely new ways.
Now, all of this sounds incredibly promising, but the paper also acknowledges that there are challenges and barriers to implementation. Let's start with the AI-related challenges.
Right. The first hurdle is choosing the right algorithms. It's not one size fits all.
Of course.
We need close collaboration between clinicians and data scientists to decide what's best for each situation. Do we need 2D or 3D pose tracking? Would a disease-specific model be more useful? How much detail do we need in the landmark tracking? If we're looking at tremor, detailed hand tracking is essential, but for gait analysis, maybe not so much.
So it's about tailoring the algorithm to the specific clinical question.
Exactly. And there are other approaches being explored, like applying deep learning directly to videos without pose estimation. This might reveal even more complex movement patterns.
So the field is constantly evolving. What about evaluating how well these algorithms actually perform?
That's another key area where collaboration is essential. Traditional machine learning metrics like Euclidean distances or confidence scores, they're not always easy to interpret clinically.
So we need metrics that are clinically meaningful.
Exactly. Things like relative tracking errors, errors for specific markers, these give us a more intuitive understanding of accuracy. Also, we need to make sure the tracked points are spatially and temporally plausible. A hand can't suddenly jump across the screen.
Right, it has to make sense in the context of movement.
Exactly. Ultimately, the evaluation metrics should align with the specific clinical task.
And the paper also stresses the importance of rigorous methodology in AI research.
Absolutely. Documentation is key. We need to be transparent about our methods. Careful separation of training and validation data is crucial to avoid data leakage. And we have to be mindful of limitations with small or non-representative data sets.
Right, the quality of the data going in will determine the quality of the results coming out.
Exactly. And often these algorithms are validated against clinical rating scales, which themselves have inherent variability.
So we need to be cautious about overstating the accuracy.
Absolutely. Incomplete documentation, data leakage, inadequate validation. These can all undermine the reliability and generalizability of these applications. The paper recommends using checklists like Tripod plus AI to ensure high-quality research. And moving forward, validation should integrate gold standard measures like wearable sensors or motion capture alongside clinical assessments.
So multiple layers of validation.
Exactly. And we also need to strive for explainable AI so clinicians can understand the reasoning behind the algorithm's results.
So it's not just a black box spitting out numbers. Finally, let's talk about the human element. The clinician and the patient as users. What are the key factors that will determine successful adoption from their perspective?
One potential concern is that neurologists might see these tools as replacing their clinical skills.
I can see that.
We need to emphasize that computer vision is not a replacement, it's an augmentation. It provides objective data to support clinical decision-making.
So it enhances our capabilities.
Exactly. But for these tools to be truly useful, they need to be robust. They need to work in different settings, inpatient, outpatient, at home, and they need to be time efficient. We don't want to spend hours calibrating cameras or processing data.
It has to fit seamlessly into our workflow.
Exactly. Right now, many computer vision frameworks are not quite there yet. Collaboration among practitioners, scientists, and developers is essential to make these tools truly plug and play.
Streamlining the process.
Right. And the good news is that patients are increasingly using digital health tools. This could help drive the adoption of computer vision. But we need to make sure these tools are user-friendly, especially for older patients or those with neurological impairments.
Designing for accessibility.
Exactly. And from a global health perspective, these tools have the potential to improve care in resource-limited settings. Remote diagnosis and monitoring could be game changers. But we need to develop solutions that are cost-effective, scalable, and equitably distributed.
So addressing those disparities in access to care, well, this has been a truly insightful discussion about the role of computer vision in neurology. It's clear that this technology has the potential to revolutionize how we diagnose, monitor, and discover new biomarkers for neurological diseases.
Abs-
And while clinical trials might lead the way, the rise of smartphone-based applications is bringing this technology closer to our everyday practice. Of course, we need to address those practical challenges related to usability and validation. And ultimately, close collaboration between clinicians, data scientists, patients, and the public is key to ensuring that computer vision is applied effectively and ethically in neurology.
Couldn't agree more. And this leads to a final thought for you, the listener. As objective video-based assessments become more common, how do you see them changing our understanding and management of neurological conditions? And what role do you envision neurologists playing in shaping this future?
Thanks for joining us on this deep dive. We'll see you next time.
See you then.